Hi there, I'm Natasha and this is Parents of Mouth Breathers. This is a podcast for parents who are done being dismissed and are ready to fight for their children's health. Today I'm going to tackle a topic that so many parents have heard of, but very few actually understand until it's too late, which is tongue tie. I've now had 2 sons affected by tongue tie and they presented completely differently. One had really obvious feeding issues and the other didn't. But he later developed airway problems and sleep disordered breathing, which I didn't know at the time could be correlated to tongue tie. So I wanted to share both stories, talk a bit about what I wish I'd known at the time and what I learned the hard way, and why this seemingly small issue can actually have really big consequences when missed. What I've learned through this experience is that tongue tie is bizarrely a bit of a controversial issue. Depending upon who you talk to about it, they have varying degrees of concern, and that really adds to the difficulty in navigating it and knowing what the best thing is to do for your child, etc. I think this is particularly important to raise because it's not often associated with mouth breathing and jaw and airway development. It's often just associated with difficulty in feeding. So I wanted to shed a light on the impact of tongue tie further down the line as children grow. I'm going to start with my eldest son. The truth is, I didn't suspect any tongue tie him because he fed really well. So there weren't any obvious signs at the time, at least not ones that I knew to look for. When I raised concerns about his snoring and the sleep apnea episodes and the gasping at night, I wasn't thinking remotely about there being any oral restriction. I was thinking very much about something obstructing his airway, allergies, and just general sleep-related issues. I didn't think at all that it had anything to do with his tongue. Fast forward a couple of years when my second son was born and was treated for posterior tongue tie. It was only during a follow-up appointment with a private practitioner who said something that really hit me. She talked about the links of tongue tie and airway issues. She previously worked within the NHS and was a long-standing midwife and went into private practice treating tongue ties. I think she spotted the demand there and the lack of intervention that's available within the NHS and set up a private clinic. She was talking about an ENT surgeon that she knew who said to her that a lot of ENT issues could actually be solved or prevented with a simple frenectomy, which is a tongue release. And she told me that there's a strong link between tongue tie and airway issues, including things like mouth breathing and sleep apnea and snoring. I was blown away because at this time I was starting to go down the doctor avenue for my eldest because of his sleep apnea episodes. It came at sort of the perfect time. It was like this piece of the puzzle that I hadn't even considered. So I started telling her, and I showed her the videos that I'd shown the doctors just a few weeks before, the ones of him snoring with his mouth wide open, gasping for air while sleeping, and just looking generally really unsettled. And I told her that I was told that it was normal, that he'd grow out of basically all the mysteries that I'd been told, that like apnea episodes are normal for everyone to varying degrees, that snoring is harmless for children. And she was completely aghast that I'd been told this information, even though she was aware that there was some conflicting professional opinions on tongue tie and airway health in general. She watched the videos, nodded along, and she really validated me. She said, "This is not normal. Obviously, there's something wrong. You could see that your child is struggling to catch his breath in his sleep, that he's very unsettled, etc." Then went on to the idea of maybe checking if he's tongue-tied. The tongue tie is something that can be genetic as well. It was safe to assume at that point that if my youngest had it, then my eldest probably would. And just as a course of investigation, she also checked myself and my partner while we were there and confirmed that we are both indeed tongue-tied. Some people are tongue-tied and it impacts them a lot more than others. There are ranges in which tongue tie affects people. For a lot of us, we just simply haven't got enough room to accommodate our tongue. Like, I know when I try to do it, I can feel my teeth either side. Effectively, if the mouth stays open while somebody tries to breathe, then obviously nasal breathing doesn't happen. And when that nasal breathing doesn't happen, everything else changes. So I was in that moment reflecting on all of my son's different issues, from the gasping to the fatigue and his nervous system seeming quite dysregulated and not being able to explain it, that maybe it was a deeper issue, one that I've been trying to flag for a while. Potentially this could be a part of the puzzle. Now, with my second son, it was almost the opposite, in that from day one, feeding was really hard, whereas my eldest latched comfortably and there was no problems. With my second, there was a shallow latch, a lot of clicking while he was nursing, and he was unsettled all the time. I had very traumatised nipples, cracked, bleeding. Think of the worst case scenario, that was happening. He had a lot of wind, what the doctors kept putting down to colic after 3 months of me just going back. I was told it was like a windy baby, or make sure you burp him after you feed him. And there's, again, conflicting information around that. Technically, with breastfeeding, as far as my understanding, is you shouldn't really need to wind a baby after they've been breastfed. It's only typically with bottle feeding, unless they're taking in excess air, and that indicates there's something wrong with the latch. So simply put, if breastfeeding is working properly, you shouldn't have to go through that whole winding rigmarole. But he was taking in a lot of air, he was having a lot of reflux, and he was so unsettled because of it all. The journey between going through all of this with him and seeking advice from the tongue-tie practitioner was 3 months, which is such a long time when you are exclusively breastfeeding, and from 1 minute to the other, it varies in how the feeds go, to the point where you dread each feed because you're scared of how much it's going to hurt, scared of how uncomfortable the baby is going to be, and all of the above. The kicker in all of this really is that I went back and forth to the doctors consistently throughout that 3 month period. I was given anti-reflux medication. I was told it was colic, which is a bit of a BS term. It's what they label if they don't know how to work out whatever's going on with the child. And then I contacted my health visitor, just trying to get somebody to listen, and nobody was taking it seriously. It was only then when I was told about some breastfeeding clinics that I went along religiously every week through this really difficult time. And a lot of the focus was around positioning and ensuring that you found the right position for the baby. Now, when I first started it, I was like less than 3 months postpartum. You're vulnerable and you're questioning yourself and you're wondering what you're doing wrong. But internally, I knew that I had 2.5 years experience of breastfeeding my first son. I knew that this wasn't right, and I knew that actually there was only so much that positions and stuff could really alter it. Obviously, with some babies that have reflux and stuff, upright feeding positions are better. If you've had a cesarean versus a natural birth, there are different positions that are more comfortable for you, all of that stuff. But the crux of it is, if that child isn't latching properly, then there's no amount of positions that can change that fact. Some sessions I remember just being in pieces in there, and oftentimes with a room full of other women that were going through the same thing. And I remember being up in the night with my youngest, trying to get him to latch, literally sobbing, so desperate for it to work, because for me it was such a beautiful experience with my first son. And I know that it is the best thing that you can offer your child, and I really wanted to offer that to my second child. So I was so stubborn, and there was no way in a million years that I was going to do anything else. Like, this was happening. Some time around then, I learned about tongue tie. I knew about it on the periphery, but I had never considered it in any more detail. I can't remember exactly whether I was like reading something online or wherever it was. And I was like, oh my gosh, maybe he's tongue-tied. I called my health visitor, my doctor, the next day. It turns out there is an easy treatment pathway. It's very bizarre. I was shouting from the rooftops. I thought that my son had tongue tied. It honestly seemed like nobody cared. It just fell on deaf ears. I remember somebody telling me that tongue tie is only treated in the NHS if it's really, really severe, to the point where a child can't bottle feed. So it was this bizarre situation where there might be something underlying with your son and you have this inclination that there is, but there is nowhere to really go. So I knew that I had to look for a private practitioner, and that's when I found one. And so I went to see a lactation consultant. She assessed my youngest and that did indeed have tongue tie. So all of these months of going through this, honestly, it was absolute torture. Solved in that one sitting. She assessed him there and then, and she treated him there and then. He was about 3 months old at that time, and he went straight onto the boob, and I was shocked at the difference. His latch immediately improved. It was still more shallow than I remember my eldest son's being, but it improved nonetheless. His feeding became much more efficient. I just felt this sense that we were in a better rhythm with it. It really validated me that time and lit a bit of a fire in me. Many fires have been lit in me over the last few years, but I was so frustrated that I had to go down the private route to get this recognised and had to go through 3 months of just this up and down, horrendous thing. You know, seeing your infant inconsolable and not knowing what to do is just the most torturous thing. So I was really angry that it had to take for all of that to happen to actually find the solution. Since all of this has happened, I've been to ENT and they've said the most ridiculous things to me when I've brought a tongue tie. The other thing is with the NHS in particular, if your baby's gaining weight, they don't look at it in any more detail. My son was gaining weight, he was taking milk and he was taking a lot of it. But, you know, weight gain isn't the only metric that matters. It's the quality of life, the comfort. And then, as I've said then, was my eldest son, that long-term airway development. Tongue tie really matters more than most people think because it's so more than just feeding. And as I outlined with my youngest son, it really affected the feeding, but because he was still putting on weight, it wasn't seen as an urgent situation. But as I learnt with my eldest, tongue tie left untreated can affect so many things, from facial and jaw development, the palate width, which affects nasal airflow. So if you've got a narrow palate at top, you're more likely to have issues with nasal breathing. Speech as well, things like lisps, but also speech delays. There's the sleep quality side of things and not getting that deep rest that young children really need. And then obviously breathing habits, so breathing through your mouth, not your nose. The tongue is a postural muscle, so it shapes the roof of the mouth. And if it can't rest up there properly, the palate just doesn't develop wide. So instead, as I said, it becomes high and narrow, and that reduces the size of the nasal airway. This is not just theoretical, it is science. For some clinical context, you might have heard me talk about Christian Guillemot before. He was a Stanford sleep medicine pioneer, and in his study in 2014, he warned in no uncertain terms that restoration of continuous nasal breathing should be the ultimate treatment goal. There was also a 2017 study by Baxter et al., which confirmed that posterior tongue ties can cause significant restriction and contribute to narrowed airway development. Another doctor is Dr. William Hang, who's an airway-centered orthodontist. Now, he teaches that untreated oral restrictions early in life can lead to, as we know, underdeveloped jaws and chronic mouth breathing, which can affect a child's nervous system, sleep and behaviour, all of which I have experienced, or my eldest has experienced. These studies are not widely talked about, and the results of them certainly don't seem to have permeated through the NHS, because when I brought these things up to the ENT surgeons, they laughed me out of the room. They just were not even remotely interested. It was though I was spreading some pseudoscience, and that isn't the case. Tongue tie can really affect the development of the jaw and the airway, and it's really important that we understand that. As I mentioned, the NHS only treats tongue tie when it's clearly impacting feeding. And even then, many trusts, depending on where you are in the country, have really long wait lists or policies that exclude certain type of tongue ties, so like posterior tongue tie, which is what my youngest had. This effectively leaves parents with two really poor options: sit and wait and hope for improvement, or go privately and pay out of pocket, which is slightly more risky as well, because you could argue that it's not as regulated. I did both effectively. I waited and I worried for 3 months, and then I paid somebody. And obviously I'm really glad that I went down that route. I think it costs around £500 per child, which is well worth it for me. But I still can't quite believe that something so impactful was overlooked so easily. After my youngest had been done, it was about a month or so afterwards that we took my eldest to be assessed. And our plan was with the practitioner that if he was good to go that day, bearing in mind he was about 3.5 at the time, we would basically go ahead and clip the tongue. I've since found out that they actually use lasers, which are painless, which I didn't know at the time. Again, some of the risks of going privately and not maybe having all the options laid out in front of you. We got him assessed, and lo and behold, it turned out he did have tongue tie. Because of all the issues that we were having with his mouth breathing and whatnot, we just decided to go for it. It's going to be temporary discomfort, but for long-term relief. That was our thought pattern. And we had had such success with our youngest son that we thought, yeah, let's go for it. So the procedure happened. He was quite inconsolable for about half an hour. It was quite traumatic. He was old enough to sort of recognise that something was happening, which was scary. We did as much as we could as parents to prepare him and then comfort him afterwards. It's not ideal to do it at his age, and certainly not that method. So I don't know that I would necessarily recommend going down the manual route. If I had known that there were lasers available, I would have gone down that route, even if it had cost a bit more. Needless to say, we saw an immediate improvement in the open mouth. So it wasn't completely closed, but it was significantly more closed. He went from having the widest open mouth you could possibly think of to maybe going down to a couple of centimetres. It was open just enough for me to see that his tongue was actually lifted up. Now, this is a bit of a side story, but what happened next was absolutely unbelievable. After the procedure happened, the bleeding stopped within about 10 minutes. There wasn't a lot of bleeding at all. My son had been having behavioural issues and a lot of emotional issues, a lot of dysregulation. Later on that evening, he had a complete and utter meltdown. Understandably so, obviously, something really scary had happened and he was really upset. But he was screaming, crying at the top of his lungs. And all of that stress made his tongue start bleeding again. And it was bleeding profusely. It was just everywhere, pooling in the bottom of his mouth, leaking out of his face. It was awful, absolutely awful. Obviously, we'd had the experience with our youngest son and nothing of that nature that happened. I was pretty confident that the reason this happened is because he'd got himself so worked up going to bed that he was really overwhelmed. So I called the practitioner and she answered my call, even though it was later on into the evening. And she said, get down to A&E. They'll be able to treat him and prevent any further bleeding. But I explained to her the situation. And before we'd had any of these procedures done, we had to sign some paperwork, read through some things, and basically in however many years that she'd been doing, I think 15, there had been a couple of cases where there was a bit of a bleeding issue and people have had to go into hospital. My youngest was about 4 months. I was exclusively breastfeeding at the time, and I couldn't go in with my eldest, so my partner went in with him, and they went into A&E, and they use something called tranexamic acid, which is an ointment or a solution that gets placed on bleeding wound and it stops the bleeding effectively. But they left this compress under his tongue for 4 hours. Then at some point took the compress away after being under there for 4 hours And underneath his tongue was like a scene from a horror movie where it was all congealed blood, but it looked like tissue. It was very misleading. So they were like, we've never had anybody with a tongue release issue before. We don't really know what to do. So we're going to ask you to stay overnight and a doctor's going to come and review in the morning. So the next morning, the doctor came to visit him and I went into the hospital at this point. This discussion was, we think that we might need to put him under morphine, put him under, do some minor surgery under his tongue to see what's going on and get in there and remove the stuff. We're like, no way. We already felt bad because we were going out on a limb here because we wanted to improve his mouth breathing. And so we felt awful, and me in particular, because I drive these things, as most mothers probably do. You come across treatment options and you're like, right, I'm going to try anything for my child. In the UK, like going for private treatment, especially when it's not something that's necessarily considered that important in the NHS, you feel as though you're a bit of an outlier, you're doing something a bit naughty. The smell coming from my son's mouth was absolutely unbearable. He still had sort of dried blood at the side of his mouth. So he couldn't really talk at the time as well because he had all this stuff under his tongue. And so I called the tongue-tie practitioner at this time. I was like, can you help? Because they're telling us he's got to go in for surgery and he's got to have morphine and all this stuff. And I'm not comfortable going down that route, especially based upon everything that she had told me, how low risk it is and all this sort of stuff. And she was like, wait there, I'm going to be down within 2 hours and I will speak to the doctors for you because this is ridiculous. There's no way that he will need to go in for surgery. So, true to her word, she came to the hospital, which must have been quite difficult for her because she used to work there. I get the sense that she's a little bit of a non-conformist, which I really like in people. I think is totally necessary, especially for people that want to foster change in a system. And so she came down and she actually requested that the ENT doctor come and see us. And she spoke to them in detail and she was like, leave it with me. And she had brought like a bag of sweets and drinks and all this kind of stuff. And she was talking to my son, and I think he was in a state of shock at that time. Really heartbreaking to see, and I was questioning every life choice up to that point. But at one point, she offered him some chocolate, and he doesn't have chocolate very often, so that really appealed to him. He just put it into his mouth and started chewing. And with that, he was effectively also swallowing all this stuff that was under his tongue. So he was then just absolutely fine. He was just really enjoying the chocolate, and then just everything was fine. She asked him if she could look under his tongue, looked under there. All this stuff that had built up in there was effectively blood clots, and they had turned into these weird colours because the tranexamic acid was left on there for 4 hours, and it should only be left on there for like 15, 20 minutes. So that just blew my mind, how we could have gone into that situation, gone into A&E, and they're basically ready to put our child on an operating table, and then this practitioner comes in with some chocolate and everything goes away, and the tongue had healed absolutely fine. Again, another reason why I'm always wanting to question the first opinion that you get from a medical professional, because that reinforced everything that I'd learned through my birth experiences and all the stuff with my eldest with his ENT issues, that you don't just take somebody's word for it because they're in a position of authority. It was just such an odd experience, but definitely one worth talking about because tongue tie isn't something that they know much about in A&E apparently. So needless to say, he came out of hospital that day. He was absolutely fine. And then we noticed this immediate improvement over weeks and weeks and weeks. We were taking pictures and obsessing over it, how much quieter he was when he slept and all that kind of stuff. But the impact that it had started to wear off, which led us down the route of allergies and intolerances, because ultimately, if a child can't breathe through their nose because their nose and their airway is obstructed, then they have to breathe through their mouth. The tongue tie really helped, but there are other issues going on as well, which is going to prevent the effectiveness of that. If you listen to this and wondering what is going on with your child, I just really want to signpost you. Don't be afraid, because of our experience, that was really to do with the fact that my son had got so stressed out afterwards that it created this overbleed. Have a look at tongue tie. Don't ignore your gut feeling. If you think there's something wrong, have a look at that first. We've had quite the ride with tongue ties and phonectomies, and I'm so glad that there are private practitioners out there that are relatively affordable and available to do what the NHS effectively doesn't. It's really helped both my sons. With my eldest, it definitely improved that open mouth posture. Unfortunately, that came back over time, which led me to think there might have been a partial reattachment. I've since had that checked with an Airway dentist, and it turns out that that wasn't the case at all. It was really effective and it did work. It's just that wasn't a one-stop solution for him. We're still very much trying to figure out what's going on, but I'm glad I did it anyway. If you listen to this and wondering what could be going on with your child, I would just say consider tongue tie, have a look into it, get assessed by a practitioner. A lot of private practitioners, they will assess it and they won't charge you. They will only charge you then if they need treatment. So you've got nothing to lose on that front. And tongue tie isn't just about feeding issues. It is also all linked to the airway development. So it's an important point that still gets overlooked. I'm going to put all the links to any of the references that I've made in this episode in the show notes. And I'll also put there my free guide, 10 signs your child might be a mouth breather. And also I'm going to put links to my Substack as well. Now, I just want you to remember you're not overthinking this. You are being really observant, which is a great trait, obviously, for a parent. You're attuned and you're trying to do what's best for your child. You're not paranoid. You're being perceptive. And I support you all the way. And I'm on the journey with you as well. So thank you so much for listening. And I will speak to you next week.